Our final speaker before a brief panel discussion and questions is Professor Dr. K.G. Vishwanathan. Professor Vishwanathan is the principal of the Vijayratnam Ayurveda College and the chief academic and administrative head of the college. He is a member of CCIM, the Academic Council of Calicut University, and various educational bodies of the Kerala, Mahatma Gandhi, and Kamur universities. He's been the convener of various international and national seminars and a key resource person for various seminar and public awareness programs. He will be describing the effect of keraleeya chikitsa Shirodhara on psychological disorders. Please welcome our next speaker.
Today, I am going to present my research paper, The Effect of Shirodhara in Psychological Disorders. Shirodhara is mentioned in Ayurvedic text in various parts. But in Kerala, as you know, Kerala is the cradle of Ayurveda. The Acharyas of Kerala tradition has formulated a particular type of Shirodhara process. Ayurveda considers the body and mind interrelated. The somatic and psychic factors are involved in the manifestation of disease, especially the mental diseases. A beautiful simile is mentioned in our text, that is a metal pot and a hot ghee. It is interrelated. If the metal pot is heat, the ghee will be hot, and if the ghee is hot, it will be transferred to the metal pot. There are many descriptions in Ayurvedic text about the psychological disorders. Generally, it is known as the Unmada. Unmada means it is the derangement of mind, decision, memory, orientation and responsiveness, devotion, habits, psychomotor activity, and contact. That is the manas, buddhi, smriti, sapnya, jnana, bhakti, shila, cheshta, ajara, vibhramam. That is known as the Unmada. How the manoroga or the psychological disorders occur? There are two factors, that is the predisposing factor and the precipitating factor. Predisposing factor is the Manasa Prakriti. Manasa Prakriti is the special description of the Ayurvedic text, and the precipitating factors are the sudden causes occurs to the human being. It results in the manifestation of the diseases. Manasa Prakriti means the psychological temperament, that is, as previous described, it is sattva, it is virtuous, and it is a balancing factor of the mind. And rajasa and tamasa, that are the destructive and sedentary factors of the manasa prakriti. These are the main psychological temperament factors causing the manoroga. How the pathogenesis of the psychological disease occurs? The vitiated doshas affects manovahasrodas, that is the thought process. Buddhivahasrodas, that is the intelligence. And sapnyavahasrodas, that is consciousness. Indriya, sensory perception. Buddhi and cognition. Jnanam, the knowledge. And these are the total effect of the pathogenesis happening in the manifestation of psychological diseases. What is the treatment plan for the psychological diseases? Generally, the general purification is done, no doubt, because since it is interrelated, body purification is a must in psychological diseases also. And special treatment is done in the portion that is the Shiras. In Bheda Samhita, as you know, there is a description that this manas is located in between the head and the throat. Positively, it is the brain, because it is a space where the manas situates. Location of mind is Shiras, that is brain. Route of administration to Shiras is mentioned in text. That is, first is the Snehapana, that is intake of Sneha. The lipid-soluble medicines penetrate the blood-brain barrier. That's a truth in the scientific field. And nasyam. Nasyam means the nasal installation of the medicine. Administration of medicine to Shiras, Shirodhara. Many medicines are indicated for the Shirodhara, especially in Manoroga, the psychological diseases. And Shirodhara is done with Sneha oil, Kshira milk, Stanya, even the breast milk is used, and Jala water, and Takra, the medicated buttermilk. Medicated buttermilk is a specialty in Kerala. In many years, our acharyas are using this very economically prepared, the takra specially prepared with the medicated buttermilk is added with amalagi and musta, that is Embolica officinalis and Cyprus rotundus. A special process is there. And the Shirodhara is the pouring of medicated liquid over the forehead continuously 30 to 45 minutes from a height of 10 centimeters, tilting from one temporal lobe to the temporal area in a uniform speed. This is the process. And I have conducted a study with the selected psychological symptoms: fatigue, insomnia, anxiety, loss of concentration, and ill-defined body pain. Mostly these are seen in depressive psychosis, and in Ayurveda it is known as the Mano Avasada. Scheduled treatment is 20 days Shirodhara with medicated takara. Patients undergone treatment 42, 16 female and 26 male. Age group is 25 and 45. Patient data is like this. The symptoms: fatigue seen in 26 patients, insomnia in 38 patients, anxiety in 35 patients, loss of concentration in 32 patients, ill-defined body pain in 37 patients. And observed results are like this. The fatigue reduced relief is 61.9, insomnia 90.47, anxiety 83.33, loss of concentration 76.19, ill-defined body pain 88.09. These are the research questions. Whether the Shirodhara, especially the Takradhara, affects or stimulate the pleasure pathway, that is the mesocortical limbic dopamine pathway, or it affects or influences the limbic system and the frontal lobe, hypothalamus, temporal lobe, arousal reaction, and the brain structures associated with behaviors, the medulla, cerebellum, occipital lobe, thalamus, parietal lobe, sensory strip and motor strip, and the corpus callosum. These are the research questions, and the research is ongoing, and the proposed work is continuing in the Shirodhara with the Takradhara. And thank you very much. Thank you for your patient hearance. Thank you.